Hello, class. How's everyone doing? I'm doing very well. Thank you for asking. My name is Philip Park. I'm joined by my friends Annie, Winona, and Justin, and today we're going to teach you guys about cerebrovascular accidents. Quick disclaimer, we have quizzes throughout the presentation, but we're not going to pause for you because we hate wasting time. We're going to expect you to pause it and do it yourselves. So here are the table of contents. I'm sure you guys can read that.
So what is a cerebral vascular accident? It is an acute stroke due to an onset of focal neurological findings in a vascular territory. A stroke is caused by a lack of blood being transported to the brain caused by either a blockage or rupture of a blood vessel. There are two main types of strokes, and the more common type is the ischemic stroke. The second type is a hemorrhagic stroke. An ischemic stroke occurs when a blood clot prevents blood and oxygen from reaching the brain, while a hemorrhagic stroke occurs when a vessel itself, within the brain itself, ruptures.
So is a stroke congenital or acquired? Trick question, it's actually both. The most common disease associated with strokes at birth would be congenital heart condition. Congenital defects can occur in chambers, walls, and valves, and vessels near the heart do not develop normally before birth, causing strokes. 20% of strokes in children are due to this. Strokes could also be acquired through the ages such as 55 to 85, gender, race, high blood pressure, smoking, obesity, and cholesterol imbalance.
When preparing a patient for the MRI suite, it is a technologist's responsibility to ensure that the patient is informed of all the risks they are taking. This includes making sure that they are aware of all the ferromagnetic items that need to be removed, such as jewelry, glasses, dentures, and even cosmetics with metallics in them. Techs must make sure that the patient is comfortable and understands all parts of the procedure, including the possible use of imaging contrast dyes such as gadolinium. Patients may also be given tools to relieve them of anxiety, such as a handheld alarm or noise-canceling headphones. In this image, the patient is wearing noise-canceling headphones due to the loud noises that the MRI machine makes.
So there are many signs and symptoms in regards to a stroke, but the easiest one to remember are the ones through the acronym called FAST. So FAST stands for face, arms, speech, and time. And there's a YouTube link top right in case you guys want to see what that looks like. In addition to FAST, there are other signs and symptoms of a stroke, such as difficulty walking, dizziness, loss of balance and coordination, difficulty speaking and understanding others, numbness or paralysis in the face, arm and legs, blurred or darkened vision, headache, nausea, and vomiting. However, symptoms may vary per individual and where it happens. If we look in the image to our right, we see that part of the brain has different functions. One can imagine that if a stroke affects a certain region of that brain, that region will give its own symptoms.
So, how is this related to MRI? In order to differentiate between ischemic and hemorrhagic strokes, a non-contrast head CT or MRI is used to determine the size and location of the stroke. Each has their own advantages and disadvantages, but CT remains the most widely used neuroimaging technique for evaluating patients with suspected strokes, while MRIs are mainly used in the assessment of patients. A typical stroke MRI protocol consists of diffusion-weighted imaging, T2-weighted imaging, fluid attenuation inversion recovery, and functional magnetic resonance imaging. Diffusion-weighted images are sensitive to early stroke, has fast acquisition time, and provides clear demonstration of the lesion. It provides image contrast that is dependent on the apparent diffusion coefficient. This describes the net displacement of molecules diffusing across an area of tissue per second. It is higher in normal tissues and lower in pathological ones. In MRI images, the radiographic appearances look different depending on the timing of the post-stroke onset. In image A, you see a patient with an acute stroke. The ADC value decreases below normal and has maximum signal intensity. In image B, the patient has a subacute stroke. The ADC value begins to rise and return to base level, which results in the signal slowly becoming less hyperintense.
T2-weighted imaging is best used to detect pathological changes within neural tissue because they can distinguish fatty tissue from water-based tissue. Abnormal brightnesses on T2 may indicate a disease process such as trauma, infection, or cancer. T2-weighted images are also good for detecting vasogenic edema that is present during the subacute phase of a stroke. On an MRI scan, these images appear as hyperintense lesions, usually appearing 3 to 8 hours post-stroke onset. Figure 7 on the left demonstrates the appearance of a young person's brain on a 1.5 Tesla scanner.
FLAIR. FLAIR images are designed to suppress signals from the cerebrospinal fluid. This is what we want for strokes, as blood would give us the high signal, showing us the hemorrhage. Depending on signal intensity, we can predict time after stroke. Higher signal would mean longer time has passed. So it's good at detecting pathologies such as subarachnoid hemorrhage by making it appear brighter compared to your traditional T1 and T2 weighted images. If we look on the image on the bottom left, we can see that the arrow is pointing at the high intensity lesion. Functional MRI. Functional MRI is a follow-up procedure that is used to study patients months and years after they have had a stroke. When there is increased neuronal activity, oxygen demand is also increased, leading to blood activity. Hemoglobin is paramagnetic when deoxygenated and diamagnetic when oxygenated. The difference in these magnetic properties lead to a difference in MR signal of blood depending on its oxygenation. So when oxygenation varies according to levels of neural activity, these differences can detect brain activity. This is called your blood oxygen level dependent imaging. If we look on the image on the first row, we can see that brain activity before and after treatment, and then on the second row, we can see the difference of brain activity before and after treatment. Red would be increased activity and blue would be decreased activity.
This image demonstrates a T2-weighted image of the right cerebral artery. Fast spin echoes can clearly demonstrate areas of edema that aren't clearly seen on a CT, which can help identify a subacute stroke. In this image, fat is suppressed, which allows for increased signal intensity of the right temporal lobe. This appearance is consistent with the presence of a subacute infarction. Here is a variety of images demonstrating the different MRI sequences.
Now artifacts. So pertaining to brain imaging, we could have flow artifacts or metal artifacts. Metal artifacts found in brain images can be caused by dental implants or neurosurgical clips, which reduce image quality by causing large magnetic field distortion and signal loss. Metallic objects may result in flare hypersensitivity, and this is due to CSF vascular pulsation, essentially the movement of the CSF. Flow artifacts is from the movement of body fluid during the sequence, and this is usually blood or cerebrospinal fluid, which retains to brain imaging because both of them are present. For the images on this slide, on the left, we have an image of the dental appliance in the right temporal lobe, and on the right, we have an image of a neurosurgical clip right at the top right corner of the brain. For this image, we have a gradient echo image on the left, and we have a DWI image on the right. As you can see, each region has a hypersensitive area, but because of the sequencing, it does appear dark on the right image and light on the left image. You would think this is an indication for a stroke. However, these are actually just metallic artifacts. So as you can see, this is very confusing for diagnosing strokes. Flow artifacts can be corrected by flow saturation, and this entails pulses being spatially selective saturation bands applied parallel to suppress unwanted flow artifacts from vessels entering a slice. Questions. What is the gold standard imaging modality for detecting strokes? Which of the following was not mentioned as one of the typical stroke MRI protocol images? Here are the answers. Hope you got them right. We have a crossword for you to do on your own time. It's very fun, very interactive. And that
Thanks for
concludes our
listening.
presentation.
Thanks for
Thank you for
listening.
listening.